a donor-friendly fundraising narrative with Quadratic funding. Wahito Medical Center, Nyumba, Mumbi One Health Campus. In the highlands of Laikipia West, a bold vision is emerging: the creation of the Wahito Medical Center, the heart of the Nyumba, Mumbi One Health Campus. This campus is designed not simply as a hospital complex, but as an integrated ecosystem where healthcare, education, food systems, and community governance work together to uplift human life. At the center of this vision stands a 300-bed rural referral hospital, a place where mothers can give birth safely, where children can receive life-saving treatment, and where communities can find reliable medical care close to home. Surrounding the hospital will be a kindergarten through 8th grade school, nurturing the next generation of scientists, farmers, and innovators. Complementing these institutions will be a food processing and training center, strengthening local agriculture and creating economic opportunity for the region. Together, these three pillars, health, education, and economic resilience, form the One Health vision of Nyumba, Mumbi. The entire campus can be built for approximately 24 million United States dollars, an efficient investment for infrastructure that will serve hundreds of thousands of people for decades to come. Within this investment, the hospital itself requires a little more than $16 million to build a fully functional rural referral facility with surgical suites, maternity wards, laboratories, imaging services, and intensive care units. The impact of each contribution is powerful and measurable. Roughly $78,000 invested creates one permanent hospital bed when the entire campus is considered, while about $55,000 builds a complete hospital bed when funds are directed specifically to the hospital facility. In education, every $1 million invested can build nearly 8 permanent classrooms, providing learning spaces that will serve generations of children. But the funding model for Wahito goes beyond traditional philanthropy. This project is being built through a new form of collaborative financing inspired by decentralized science and public goods funding. Contributions to the Wahito campus participate in a quadratic funding mechanism, a method pioneered by the Ethereum Foundation and widely used in the Bitcoin ecosystem to support public goods. Quadratic funding ensures that the strength of a project is measured not only by the size of individual donations, but by the breadth of community participation. When many people contribute, even in modest amounts, the system increases the matching funds available to the project. In this way, the collective voice of the community amplifies the impact of every donor. Through this mechanism, supporters of Wahito are not merely donors. They become participants in a decentralized movement to build global health infrastructure. Contributors who support the project receive Actuate tokens, a digital asset created by Actuate Foundation to mobilize capital for healthcare delivery and biomedical discovery across Africa. These tokens represent participation in the broader Actuate ecosystem and help fund initiatives that advance health equity and scientific innovation. In addition, contributors who participate in the Wahito funding rounds may receive Mumbi tokens, which provide governance rights within Nyumba Mumbi, the community framework guiding the project. Through these governance tokens, supporters can participate in decisions about the campus's future development, programs, and expansion. This model transforms philanthropy into shared stewardship. Donors become collaborators. Contributors become builders. Supporters become governors of the institutions they help create. Furthermore, Wahito will employ principles of retroactive public goods funding, rewarding those who contribute to the creation of measurable impact. Once the hospital, school, and food systems begin delivering tangible outcomes, such as patients treated, children educated, and farmers supported, future funding rounds can reward early supporters whose contributions helped make those outcomes possible. In this way, Wahito aligns generosity with innovation. It invites the global community to participate not only in giving, but also in building a decentralized public good. A contribution of $100,000 can help build more than a hospital bed. A contribution of $1 million can help construct an entire clinical unit or school wing. Hundreds or thousands of smaller contributions, when combined through Quadratic funding, can unlock even greater matching resources. Each gift becomes part of a network of generosity. Each supporter becomes part of a decentralized community. And each life touched by Wahito becomes a testament to what humanity can build together. The Wahito Medical Center, Nyumba Mumbi campus, is more than infrastructure. It is a new model for how the world can finance health education and human flourishing. Through the power of decentralized participation, the future of healthcare in Africa can be built one contribution, one token, and one act of hope at a time. Your legacy of healing. A sponsorship ladder for the Wahito Nyumba Mumbi One Health Campus. When you choose to support the building of the Wahito Medical Center, you do more than make a donation. You take part in building an institution that will serve families, mothers, children, and entire communities for generations. Your contribution becomes something tangible, a place where lives are healed, a room where a child learns, a ward where hope returns to a family. The sponsorship ladder invites you to choose how you wish your legacy to live within the Nyumba Mumbi One Health Campus. You build the campus. Founding visionary, campus builder. Contribution, $10 million or more. You stand among the founding builders of the entire One Health Campus. Your leadership helps bring into existence a place where medicine, education, and economic vitality meet. Your name becomes permanently associated with a central campus landmark, such as the hospital complex, the main academic building, or the central campus plaza. Every person who enters the campus will see the story of your leadership and generosity. You do not simply support the project. You help bring the entire vision to life. Hospital Wing Founder. Contribution, $5 million. Your gift builds a major clinical wing within the hospital. This wing may include surgical suites, maternity and delivery units, pediatric wards, or specialized treatment areas that will serve thousands of patients every year. Your name will mark the entrance to a space where doctors save lives and families find healing. For decades to come, people will say, this place exists because someone cared enough to build it. Clinical department patron. Contribution, $2 million. Your support establishes an entire clinical department within the hospital, such as maternal health, pediatric medicine, emergency care, or infectious disease treatment. You help create the spaces where physicians and nurses will care for the most vulnerable members of the community. Your name will be honored at the entrance to the department you helped create. Every patient treated there will carry forward the legacy of your generosity. Ward Builder. Contribution, $1 million. Your contribution helps construct an entire patient ward. This ward will hold many hospital beds where mothers recover after childbirth, children regain strength after illness, and families experience the miracle of healing. Your name will mark the ward, reminding generations of patients that this place of care exists because you chose to build it. Classroom Founder. Contribution, $500,000. Your gift builds an entire classroom within the campus school. In this room, children will learn mathematics, science, language, and the skills needed to shape their future. The classroom will carry your name, and every child who studies there will learn within a space that your generosity created. Education begins with a room. Your room becomes the place where futures begin. Laboratory or training room sponsor. Contribution, $250,000. Your support establishes a laboratory or training room where students, nurses, and healthcare workers will gain the knowledge that strengthens the community. You help prepare the next generation of healers, teachers, and innovators. Your name becomes part of the intellectual life of the campus. Hospital Bed Patron. Contribution, $100,000. Your gift builds more than a hospital bed. It creates the clinical space that surrounds it, the infrastructure that allows doctors and nurses to deliver life-saving care. A plaque beside the bed will honor your role in bringing healing to those who need it most. Every life touched in that space becomes part of your legacy. Community builder, contribution, any level, even modest contributions carry extraordinary meaning when joined with others. Through the decentralized funding model organized by the Actuate Foundation, your participation also connects you to a global movement for health and science. As a supporter, you receive Actuate tokens, recognizing your participation in building decentralized health infrastructure. You may also receive Mumbi tokens, granting you a voice in the governance of Nyumba Mumbi and the continued development of the Wahito campus. Because the project uses quadratic funding and retroactive public goods funding, your participation multiplies when many others join you. Your generosity becomes part of a larger community effort that unlocks greater impact. The invitation. This campus will rise because individuals like you choose to act. When you step forward, you do not simply fund a building. You create a place where life begins safely, illness is treated with dignity, and knowledge prepares the next generation. Your name becomes part of a story that will be told for decades. A story of people who believed that hope should take physical form. A hospital, a school, a community of healing. And it began because you chose to build it. From miles to medicine, connecting the Boston Marathon Global The Run Where You Are campaign to building Wahito. Every great movement begins with a simple act. In this case, the act is running. Through the Boston Marathon Global Run Where You Are campaign, runners across the world are invited to transform physical endurance into social infrastructure. The building of the Wahito Medical Center, the heart of the Nyumba Mumbi One Health Campus. The numbers behind the project make this connection remarkably tangible. From your miles to medicine, how your run builds Wahito. You run for many reasons. You run for strength, for discipline, for clarity of mind. But now your run carries a deeper meaning. When you run as part of the Boston Marathon or join the Global Run Where You Are campaign, your miles become more than personal achievement. Your miles become the foundation of the Wahito Medical Center, the future heart of the Nyumba Mumbi One Health Campus. Imagine this. Somewhere in the highlands of Laikipia, a mother is preparing to give birth. Today, she may travel hours to reach a hospital, but because you chose to run, the hospital she needs will rise. Because you moved your feet across a road or a trail, a place of healing will stand where there was once only open land. The entire Wahito campus, hospital, school, and food systems center requires roughly $24 million to build. Within that vision, every hospital bed represents about $78,000 of infrastructure across the campus. Now picture what your running makes possible. When a sponsor supports your run at $1,000 per mile, your effort becomes transformative. If you run 10 miles, your run generates about $10,000, helping build the clinical spaces where doctors and nurses will care for patients. If you run a full marathon, more than $26,000 flows toward the hospital. 3 runners like you, running with purpose and inviting sponsors to support you, bring enough support together to build a permanent hospital bed. Think about that for a moment. A hospital bed where a child will recover from illness. A hospital bed where a mother will safely deliver her baby. A hospital bed where a life will be saved. And that bed exists because you ran. Now, imagine what happens when thousands of runners join you. If 1,000 runners across the world run a marathon and invite sponsors to support their miles, the movement raises more than $26 million, enough to build the entire Wahito One Health Campus. That is the power of one runner multiplied by many. Wherever you live, Boston, Nairobi, London, Cape Town, Tokyo, You become part of the same story when you run. Whether you run 5 miles through your neighborhood or complete a marathon distance, your steps move this vision forward. Your participation also connects you to a global community through the work of the Actuate Foundation. When you and your sponsors contribute to the project, you receive Actuate tokens, recognizing your role in building decentralized health infrastructure. You also receive Mumbi tokens, giving you a voice in the governance of Nyumba Mumbi and the future of the Wahito campus. Your participation, therefore, becomes more than philanthropy. It becomes stewardship. You do not simply give. You help guide the future of what you build. Because the project uses quadratic funding, your participation becomes even more powerful. When you run and invite many people to sponsor your miles, even with modest contributions, the collective impact multiplies through matching funds. Your community amplifies your effort, and when Wahito begins to serve its community, when patients receive treatment, when mothers deliver safely, when children enter classrooms, future retroactive public goods funding rewards the early supporters who made the vision possible. Your run becomes part of a lasting legacy. So when you lace up your running shoes, remember what your miles mean. Each mile you run becomes a brick in a hospital wall. Each marathon you finish becomes a ward filled with healing. Each step you take brings hope closer to families who need it. Run where you are. Invite your friends, your family, and your community to support your miles. And know that somewhere in the highlands of Laikipia, a hospital will rise because you chose to run.